Good day and welcome to this edition of Plymouth Profiles. This show is an opportunity to speak with people from the greater Plymouth community. And today we're delighted to have another representative from Beth Israel Deaconess here in Plymouth. We're joined by Dr. Matthew Gwiazdon. Dr. Gwiazdon, thanks for being here.
Thank you for having me.
So Dr. Gwiazdon, tell us a little bit about your background. Where did you grow up and where did you get your education?
Yeah, so we've done a lot of eastward migration over the last few years, my partner and I. I'm originally from Whitefish, Montana, so far in the northwest, right by Alberta, near Glacier Park. Did medical school at the University of Nevada, Reno, go Wolfpack, and then did residency in internal medicine at the University of Utah in Salt Lake City, and recently completed my fellowship in specialized infectious disease training at Beth Israel Deaconess in Boston, and I'm happy to join the sort of extended Beth Israel Leahy Health family here at Plymouth full-time now.
And what brought you to Plymouth?
So my partner Misha had already been working as a hospitalist at that hospital and was really enthusiastic about the setting of the hospital, sort of a bridge between community and academic, and really enjoyed the patient population. And when the opportunity presented itself, I sort of leapt on it because it's an exciting way to stay a part of the bigger academic Beth Israel Leahy Health infectious disease community, still correspond frequently with mentors and former classmates, but also a place to sort of, I guess, cut my own teeth, if it were, as sort of in a leadership position here at Plymouth, because I'm also the director of antimicrobial stewardship in my new role. So making sure the antibiotics are the right ones for the right amount of time.
So here in Plymouth, there's a program, the initials spell Access. Tell us a little bit about that.
So the Access program is part of a sort of federal program, if you will, called the Ryan White program. And it is a federally funded program to assist persons living with HIV to access healthcare, and sort of also provides sort of wraparound services, including sort of transporting them to their appointments, making sure they don't have any food or housing insecurity, helping connect them with sort of substance use disorder treatments. So it's sort of like an adjunctive addition to what a patient might have for insurance who's living with HIV. So it helps sort of fill in the gaps.
Now, we're taping this in the end of October 2025 when the government is currently shut down. Does that affect any of this federal funding?
It does not, or has not, affected the federal funding. We're still sort of fully operational and funded. It is an issue sort of that's causing more broad questions about sort of programs such as ours. And I will certainly be reassured once the government's open and we have reassurance that these important measures are still supported by our national leaders.
Now, I'm old enough to remember when Ryan White was alive,
yes,
and when he was a spokesperson for our poster child, if you would, for AIDS. But for people that are watching that have never heard of Ryan White, tell us a little bit about him.
Yeah, I'm so glad you asked, because I'm a sort of a medical history buff myself. So in the early days where HIV/AIDS emerged as an infection, one of the populations that was quickly affected was patients that required transfusions of pooled blood products. So Ryan White had hemophilia, which he inherited at birth. And before we knew about HIV as a virus, it infected a lot of people with that condition, because to replace their clotting factors, they required donations from large groups. Whereas if you or I needed a blood transfusion of red blood cells because of a car accident or something like that, is usually sourced from one person. So the odds of contracting a bloodborne virus are pretty low there. But these people with hemophilia, the stuff that they would get would be sort of a collection. And before we knew we had to screen it for viruses, a lot of them became infected with HIV. And he became a spokesperson because early on, as the infection epidemic emerged, there was a ton of stigma around HIV/AIDS. You know, people wouldn't even want to touch patients or family members who were infected with the virus. And while we've come a long way with stigma associated with HIV, there's still a long way to go. But he was a very important spokesperson for that. Other notable figures would be Princess Diana, was someone who embraced an African child living with HIV, sort of breaking down those stigmas, because we know now that transmission isn't airborne, it's not on surfaces, it's specifically from exposure to infected body fluids, which I'm sure we'll probably talk about more.
And in the case of Ryan White and the Princess Diana's people that she championed, it wasn't due to sexually transmission.
That's correct. Well, so in terms of sort of children, which we see more in sort of developing countries like Africa, there's what we would call vertical transmission. So if a mother is infected with HIV and it's not treated, when she gives birth, there's a risk that the baby will be exposed to the virus and will sort of acquire it before it has a chance to breastfeed, much less have any sort of sexual contact. And then Ryan White, as we talked about, was from the exposure to the blood products for his hemophilia. So you're correct.
And so this specific program in which you're involved, the Access program, how long has it been in existence?
So I have only been here a short time, but it has been up and running and supporting people living with HIV in our community for 25 years now, coming up on the anniversary.
How many people have been helped?
So I think the number of total people that have been helped is in the range of 300 to 400 that we've cared for over the years. Currently, we have, I think, about 120 active patients that receive support through this federal funding through the Ryan White.
Because living and working here in Plymouth, it's not something you necessarily hear about, and yet among the population, we do have people that are in need of treatment.
Yeah, and I think there's good and bad about not necessarily hearing about it. The good side of that would be that the current medications that treat HIV are so effective that the infection doesn't really affect their lives beyond having to meet us every once in a while and make sure things are still going good and take, one pill a day. Whereas before, when the sort of treatment was still in its infancy, it would be very complicated regimens with a lot of side effects that would still have breakthrough treatment failure. So on the one hand, it's good that we don't hear about it, but on the other hand, it definitely leads to people in the general public not being aware of how big of a problem it still is in 2025, which is why I'm excited to be here with you.
So in 2025, does anybody still need to die of AIDS and HIV?
No, I don't think anyone should be dying of HIV/AIDS in 2025, either in Plymouth, Massachusetts, the United States, or anywhere in the world. The treatments are safe, effective, very minimal side effects, very minimal interactions with other medications. Resistance has been much less of an issue for my generation of infectious disease doctors than prior. And when I first meet a patient with a new diagnosis of HIV, I say to them sincerely that if I had to choose between having a diagnosis of diabetes, which is very common, and HIV, I would pick HIV 10 times out of 10 just because the meds are so good. And we're seeing more and more people living and dying of completely unrelated causes.
How do you help people with the HIV/AIDS?
Yeah, so I think the first most important part is preventing people from getting HIV/AIDS, which involves a number of things that we can offer separate from our program. But focusing on the program, the first and most important thing would be diagnosing a person with infection with HIV. So oftentimes it's a chronic asymptomatic infection. So if we don't test for it, we'll never know anyone has it until it's way down the road and bad things start happening, which isn't where we want to be. So the United States Preventive Service Task Force recommends that everyone, regardless of risk factors, be tested for HIV at least once in their lifetime, just because it is so treatable.
And how do you get tested?
It's blood. Most common is a simple blood test. It looks for both the antibody response to the infection and also the antigen of the virus, which is a little shop talky, but it is it's the same. You can just put it on any blood test that, if you're drawing it for your basic labs, it can just go on there without you having an extra poke or any fasting or anything.
Years ago, I heard that some people didn't want to get tested because they're concerned about insurance finding out that they were tested and that might affect insurance coverage, particularly life insurance.
Yeah. So
Is that true today?
I think there are people that are still resistant to being tested, and Massachusetts is a consent state. So some states, if you're in the hospital and your doctors think it's a good idea to screen for HIV, you don't have to get direct verbal permission for that specific lab, kind of like all the other labs that you might do as part of the treatment of that patient. In Massachusetts, there is still a law on the books that says that if I think you should be tested for HIV, I have to say, explain it to you and get verbal consent for the testing. And I think that probably reflects more stigma that's persistent from the early days of HIV, rather than, I think most people, I haven't heard patients express like explicit concern about, if it's positive, what will that mean for my insurance? I think it's more, oftentimes I hear, I couldn't possibly have that infection, doctor. It's something that I don't do those kinds of things, which, as we've discussed, doesn't necessarily mean you couldn't have it.
One of the things that I'm curious about is that, again, at this time, we're hearing a lot about immunization and vaccinations. And there's a lot at the a lot of talk at the national level about anti-vax. And so is your program being affected by people at the national level talking about not getting vaccinations and immunizations?
So in a broad sense, I have seen an increase in what we would call sort of vaccine hesitancy since the COVID vaccine debuted during the early days of the pandemic, in which patients are more resistant to the idea of vaccinations, particularly for COVID vaccines, because it's had a lot of sort of social media buzz around it. But I do think it does trickle down to affect other vaccines. I don't necessarily wouldn't say, very recent rhetoric surrounding vaccines that I've seen a real effect from that, but I think, the logic follows that if you have people in high roles sort of expressing vaccine hesitancy, regardless of what our data shows, that it sort of further pushes people who might already be thinking, well, I don't know, I don't really get the flu. I heard from my coworker last time they got the flu shot, they got the flu. Things that we know don't happen, but that when you have sort of people in high offices sort of leaning into that, it certainly doesn't help the issue of vaccine hesitancy, which is, from my perspective as a MD, infectious disease trained doc, sort of a settled issue. I enthusiastically and without hesitation get my own vaccines. And if I were worried about a patient having potential vaccine side effects, I would tell them. But I try and give my patients the same advice I give my family members, and that is sort of an enthusiastic endorsement of vaccines. And sometimes that sort of breaks through sort of what's circulating in terms of skepticism, and sometimes it doesn't. But I'd say the trend seems to have started around 2020, and I haven't noticed a huge uptick, but I do worry about that moving forward.
So the program access is for AIDS, comprehensive care, education, and support services. That's the program. And one of the other words being thrown around now is PrEP. What is PrEP?
So PrEP is pre-exposure prophylaxis. So PrEP is the use of versions of the antiretroviral medications we use to treat HIV as a way to prevent acquiring the virus from sexual activity is usually how we see it. So patients who have had a previous sexually transmitted infection or sort of described to us more high-risk sexual behaviors, such as multiple partners, unprotected sex, can, by taking these safe and well-tolerated HIV medications, even if they have a high-risk sexual encounter with someone who's infected with HIV and not treated, it's been shown to be upwards of 96% or above effective at preventing that uninfected person from acquiring the infection, even if they're exposed to it.
Then another thing I've heard about is almost like a morning after pill, but I don't know if it's for HIV. And I think in the past, some of us, for other reasons, maybe the flu or something, have had doxycycline. And I hear that has also been used by some people as a morning after pill.
Yeah, I mean, you're really sort of on the cutting edge of infectious disease because that's a really exciting new topic. So doctors love our acronyms. So we have PrEP and we have PEP.
PEP?
PEP.
Okay.
So PEP is post-exposure prophylaxis, which means you might not already be on PrEP, but you go to, whether you go to have a high-risk sexual encounter or potentially victims of sexual assault or even needle stick injuries from healthcare workers or other people like first responders, we give the antiretroviral medication after the exposure. Ideally, the sooner the better. And that also reduces your risk of acquiring the infection. The doxycycline is really more of an additional thing that particularly sort of reduces the risk of acquiring other sexually transmitted infections. It's most effective for syphilis, which we've seen a national rise in the incidence of, but it also can be helpful for gonorrhea and chlamydia. So it's just, if you did something maybe you weren't intending to and you're a little worried if you might have contracted something or that you're at risk of it, it's just a single dose of 2-doxycycline, which here in Massachusetts, because of Lyme and tick-borne illnesses, we're all pretty familiar with.
Right.
So it's a one-time dose, 200, very low risk of side effects, and it's very, very effective at preventing acquiring syphilis, and it's pretty good at chlamydia, and gonorrhea is a little trickier.
So going back to the PEP, is that now going to be a protocol in all medical offices to have that available in case someone does contract blood contact with someone who has HIV?
Yeah, at least since I've been in the field, it's been protocolized, and occupational health departments across the country have ways of responding to exposure to body fluids, which includes not only post-exposure prophylaxis for HIV when relevant, but also different things that we do to prevent or minimize the risk of acquiring viral hepatitis would be another bloodborne infection we worry about.
It strikes me that it would be not just hospitals or doctors' offices, maybe even dentists.
Yeah, it can be, it benefits not only people in all lines of work, but I've answered calls from, patients who were just out in the community and were throwing a ball around for their dog and thought they might have been stuck by a needle they didn't see, and then it kind of stuck them. So I think anyone who's worried about an exposure, it's definitely something to be aware of because it really can be quite effective at preventing acquiring these infections that then cause you, it's sort of we don't yet have a cure for HIV. So preventing the acquisition is sort of the best case scenario. But the good news is in the unlikely event you do acquire the infection, the treatments are effective. But I would rather have PEP than a lifetime of ART, even with as good as it is.
Sure. So you mentioned about 100 people in the program. How does someone get in the program?
Yeah, so the program is exclusively for people who have been diagnosed with HIV. We see patients from all walks of life, HIV or not, in our infectious disease clinic. But as part of the program, if a new diagnosis comes through at the hospital, they would be referred to us. And then also, anyone who is moving to the area or can be referred. In terms of how we survey for people who might benefit from it, I actually don't know the answer to that, but would be something that I'd be happy to look into and get back to you. But I think we're pretty well known within the Beth Israel Plymouth system, and most people who get diagnosed with HIV go to infectious disease anyway, and then we can sort of also bring in all those other resources that come along with the access program in the Ryan White. So that's probably how I'd imagine it happens most times, is that they're referred for HIV care, and then we say, good news, we also have all these additional resources and help with other things that might be.
So the status of HIV and AIDS today, let's say nationally, and then maybe even in Massachusetts or Plymouth, how would you describe it? Because again, going back to when Ryan White contracted and had it, it was viewed as a death sentence. And now today, we don't really hear about it, except during COVID, we heard about it when the lead doctor helping with COVID had helped with the AIDS, and then there was the controversy about him. But other than that, we don't really hear a lot.
Yeah, so one of the things that drew me to infectious disease in general and HIV care in particular is that it's a problem for which we have solutions to, and it's a matter of bringing resources to bear that we also have. So I think the status of HIV right now on a patient level is amazing. The testing is very effective and easy. The treatment is very effective and has minimal side effects or risks of failure. Sort of the bigger problem is adequate testing, because there's a lot of people just out in the community who might not know they have HIV, and it's better to find out about it from a routine lab test with your primary care doctor than to develop some odd, very dangerous, opportunistic infection. I think in 2019, there was a goal that was set as part of what was called the End HIV Epidemic, in which our country wanted to reduce the rates of new cases of HIV by, I think, 75% by 2025 and 90% by 2030. And we're dramatically short of that goal at this point in time. I was looking at numbers before coming to meet with you here, and I think between 2019 and now, the national average has only improved less than 10%. Massachusetts is better with a reduction in the new cases of about 25%, but still well below the goal of 75%. And the reason why that's so important is that, the more people that are diagnosed and treated with HIV prevent the ongoing spread of the infection. And we have the tools in our toolkit. We just need to use them, and I think it helps everybody. So I think for a patient who has a diagnosis, things are really good in 2020 and 2025. From a public health perspective, I think there's still a long way to go, unfortunately.
And what is the explanation of why currently it's a lesser amount than what the goal was projected?
Yeah, I mean, I think that's a tough question to answer, but I'm happy to give it a go. I mean, I think, the reality is that a lot of the people who are at risk of acquiring HIV at this point in time are otherwise young and healthy people. And in our healthcare system, my completely anecdotal experience is that young and healthy people have a lot of barriers to accessing healthcare, having primary care doctors, and oftentimes will seek care sort of broken up in either urgent care clinics or the emergency department, who might not be thinking of HIV when they're there for a sore throat or for even gonorrhea and chlamydia. When I did a research project in Utah, we found that when a person went to the urgent care to be tested for gonorrhea and chlamydia, they were only tested for HIV 20% of the time, which they have the same risk factors. So theoretically, that number should be near 100%. Mm-hmm. So I think we're under testing. I think we could do a lot to improve people's access to sort of the routine care that would help prevent these infections and treat them if they were acquired, because that has knockdown effects for any other future sexual partner. Because we know now that when someone's on treatment for HIV and we're able to suppress their viral load, which has become quite easy in 2025, the risk of them spreading HIV to a sexual partner, even with no condom or protection, is functionally zero. They did big studies where one long-term partner had HIV, the other one didn't, and the long-term partner was on effectively viral load suppressing regimen, and they had literally over thousands of couples and thousands of potential exposures, literally zero cases of the partner. So when our patients, the other thing I really like telling patients, diabetes line is one. The other thing is undetectable, meaning the viral load's undetectable. It means untransmissible, meaning you cannot give the HIV infection to a sexual partner if you're on effective treatment. And I think you can intuit how important that is from a public health standpoint as well.
So in terms of counseling and testing for the people out there that maybe are taking advantage of services, is it possible to get any of this at no charge?
So a lot of this should be rolled into primary care preventative medicine in terms of being tested for screened at least once in your lifetime is sort of a universal recommendation. And there are a lot of resources available to help support people seeking HIV care, like our Access program and even PrEP outside of our clinic. I don't want to say that there's a way that people can get it with no charge, because it's sort of a shifting landscape, and I'm not exactly sure of all of the nuances that go into it. But there's a lot of really robust resources, and if someone is unable to have HIV care, certainly for a financial reason, that's when our Access program and clinic can step in. In terms of what's available to the general public of Plymouth, Massachusetts, when they go to see their PCP, it's required that the screening be covered, at least under current legislation. In terms of what the funding would be for like something like PrEP, I don't know, because I don't do primary care here, but when I've done it in our ID clinic, I haven't had too much of an issue. So I think there's really robust financial support.
So I'm going to date myself a little bit, but when I served on the board at the hospital years ago, there was a doctor, Dr. Frank Finkelstein, who was known as the AIDS doctor in Plymouth, and I think AIDS cases were referred to him. But you have a team. I mean, would you say that you work with a team of people? I mean, you work with primary care physicians and other nurse practitioners?
Yeah, absolutely. I mean, I think we have our immediate team in our Access program, which is myself and another infectious disease doctor, Dr. Stephanie Margolin. We have a nurse, NP, but currently practicing as a nurse to sort of support the grant and the care of patients. We have a dietitian who can support our HIV patients, as well as two stellar case managers who've actually joined me here today. And so shout out to them. And then in general, infectious disease is a big kind of family team in general. I was just at our national conference in Atlanta, Georgia, just this last week. And so I'm always drawing on resources and expertise from outside of our immediate vicinity in order to help provide the best care possible, because things can get pretty complicated when they aren't going exactly as you planned. So it's good to have a phone a friend.
And when you're not doing your work as a physician, what do you like to do in your spare time?
Yeah, so I don't have any kids except for my corgi, Francis. And, we go to a lot of concerts. And when we're sort of home, we do skiing, water skiing. I was telling you before we started, we had a sailboat on Flathead Lake in Montana. And so I've sort of been eyeing the idea of getting back into that here. I'm sort of an anachronistic collector of things, so I buy a lot of vinyl records and sort of relax and listen to those. And whenever I have a chance, getting back out to Montana to see my family, my mom and my siblings, is big for me too.
Good. Lots of good water skiing and snow skiing here. So
I know, yeah. My nephew skis for Boston College, Bodie Flanagan. So I also go to some of his carnivals and cheer him on as he represents the region.
Dr. Matthew Gwiazdon, thank you so much for being here. This concludes this portion of Plymouth Profiles, but please stay tuned and join us for our next guest from the Salvation Army. Thank you. I'd like to welcome you back to this presentation of Plymouth Profiles, and for our second half of our show, we're delighted to welcome Pastor Ann Rich from the Salvation Army. Welcome.
Welcome, my friend. Good to see you again.
Thank you to have you here.
Meeting.
Yes, thank you for being here. So, Pastor Rich, tell us a little bit about your background. Where did you grow up? Where did you go to school? How did you happen to get involved in the Salvation Army?
Well, I had family that was involved in the Salvation Army years and years ago, but I grew up in Wellfleet on the Cape.
Okay.
And I still have family that's down there. I reside in Eastham, though I have a house here in Plymouth. And I jump the bridge every day from Eastham to Plymouth to go to the Salvation Army Corps and Community Center. Let me see. It had to be, my son was just born, and he's 33 now. There was a need for a music teacher. That was my background for the Salvation Army Music Department, and I applied for the job and got it, and started there teaching guitar, piano, drums, creative writing to children and adults who wouldn't have a chance for a lesson. And I would travel teaching these music mentoring courses all around the state of Massachusetts, as high as Newburyport, out to North Adams, down in Hyannis, just not the inner circle. My music director took care of that for that time, but that's how I got involved with it. And it went from that for 24 years I did that. And then COVID hit. And the assistant music director that I became position was eliminated, and I was asked to go on into being a program specialist when I went to New Bedford during COVID and worked with the mayor's office and the Salvation Army down there to provide resources, computers for children in the schools that wouldn't have that. And we did a large coordination, and I went from there to Plymouth, out to Brockton, and did the same thing. And when the post came up to be in charge in Plymouth, that's where I took my post there with a Major Deborah Coolidge, who retired, and I've been there. This is my third year.
Good. And for the people that don't know, where is the Plymouth location?
Oh, I love to say that. It's 52 Long Pond Road. It used to be the old Elks building, and it's right across from Friendly Ice Cream. So you can't miss that. Take the left into the parking lot, and you're right there.
You're also right near my office. I'm at 124 Long Pond.
Good people hang around together on the same street.
And my law partner, Alan Coster, I know has been very involved in the past with this.
Alan is a gift, I'm telling you. I have a wonderful advisory board made up of 13 members of the community that really help direct where I can do the most good. And Alan is one of those. And we're very, very grateful for the wisdom, because it's, at heart, we are an organization that believes in unconditional love and service. No matter what your background is, your belief, your nationality, it's all about people, and it's all about helping people unconditionally. And certainly my board reflects that and helps direct me where I can do the most good.
So before we came on camera, I was mentioning to you that my first exposure to the Salvation Army actually was in high school. In English, reading a George Bernard Shaw play, Major Barbara, in which the lead character was helping the Salvation Army. But give us a little bit of the background or history of the Salvation Army for people that might not know.
The Salvation Army began in England with William Booth and Catherine Booth. And from there, it spread to the United States. The idea was that we wanted to help people who were marginalized, who were not being helped. At that time in England, you had men going out and spending all the family money on drink, and the women and the children were home, and they weren't being helped. And William Booth wanted to be that tangible. It started off with soup, soap, and salvation. You're not going to win somebody's heart if they're hungry or if they're dirty. They need help. So that's what the early, it was called the Christian Mission, before it changed to the name the Salvation Army. And that's what the mission was to help people and make a change in lives for their good and to support the families. And then it was at a meeting that William Booth heard someone say, we're a vast and mighty army. So he changed the name to the Salvation Army. And thus we have sort of a militaristic look to us with our uniforms. And as you so well alluded to, we have majors and colonels and captains and lieutenants. And I am an envoy. I am an envoy in charge of the Plymouth Corps. So though I have my ministerial degree, I did not graduate from the School for Officers Training, but I am allowed to be in this vicinity and serve as a pastor in this community and love every portion of it that I do.
From what school did you graduate?
I graduated from, first Nauset Regional High School, and then I'm continuing my education with Westfield State University, finishing up from there.
Okay.
And Trinity School for my.
And for people that don't know, where would Salvation Army fit in terms of denominations? You mentioned Christian.
Yes. Well, it originally came out of Methodism.
Okay.
Right. And then Salvation Army is a form of that, but that's its basic background of it's non-denominational. It is his own organization to serve with distinction.
So locally in Plymouth, when we met once before, I mentioned some of my early involvement with the local Plymouth Salvation Army was on Easter for the sunrise service, because the former location of the Salvation Army was right there on Coles Hill.
Oh, beautiful. Location.
Yes.
Absolutely.
And but of course, in more recent years, certainly at the holiday times, the Salvation Army works very hard. So tell us a little bit about that. We're taping this in October of 2025, and we're going to be starting to approach the Thanksgiving and the December holidays.
We are there. Let me tell you, we're doing our Christmas applications now and our Thanksgiving applications for families. who need help with toy assistance. I have wonderful volunteers. We have another Christmas toy shop where the parents can come in and they go with a concierge that has a holiday name, might be Twinkles. I go by Wrinkles. And they're able to shop for those children and pick the toys that they want. And we do provide Thanksgiving meal for them in a bag that they can take. And we've seen a huge increase, of course, with everything that's going on. We're doing it pretty much 24/7. And then our kettle season will kick off, I believe, the 9th of November at Market Basket to bring in the funds that we need to continue to serve the people of Plymouth, Kingston, and Carver. That's my area. So those families come in and seniors come in. Last night, for example, we had our grab-and-go meal. We served over 150 meals. This started just before COVID, so folks had a hot meal. The last Tuesday of every month, folks come in, they tell us how many meals they want. They drive around. I have a retired Master Sergeant, Andrea. We call her Sarge. She's just a little thing. But boy, can that woman cook. And she made chicken cacciatore with all the fixins, homemade. And folks come in and know that Sarge, that's how she loves. She's a volunteer. She does that at the end of the month. She also comes in and we do almost 70 or 80 people for a senior breakfast the second Wednesday of the month. We call it the Breakfast Bunch because it's a place where people can come, have a great meal, have a wonderful conversation, find out about things that are going on, things that maybe we can help them with, Good Neighbor Energy Fund or other ways to serve. And they go away feeling valued because it's about love, Steve. You know, our senior population, it's sort of the unseen. And I don't believe in that. I believe they should be seen, and I believe folks need to know. We have an after-school program of about 15 to 20 children, where tonight we have the first woman who graduated from Woods Hole Oceanographic Institute, taught down there. She's a modern-day Miss Frizzle, I tell you, Sandra Locke, and she brings all our STEM and science program. We have music programs. We have homework help that's there, and our kids test a grade above when they go back into school. We make sure of that because it's about changing lives, from the youngest, the 5-year-old, to the 18-year-old that comes, to our seniors who give back 100-fold. So that's just some of the things that's going on, and that's why I love it so much, because it's not so much about saying the name the Salvation Army. That shield speaks for itself, but it's about the people that we help and the lives that we change. And if you come in my chapel anytime, I have more people come in thinking we're the thrift shop. And I tell them all the time, I'd love to give you pants, but if you'd like to go to a senior Parkinson's exercise class, I can sign you up for that. Or a senior, you haven't lived to, you've seen 35 seniors, uppercutting, cross-cutting, and getting their exercise in. Or if you'd like to come to breakfast, or if you'd like to come to a Sunday service, the first thing you'll see are flags of the nations on the walls on there, because everyone is welcome. We have Haitian, we have Vietnamese, we have Dominican, we have our locals that come, and we average about 70 to 80 on a Sunday service, and it's about love. As soon as someone walks through my door, I say, welcome home.
So as we tape this today, the federal government is shut down. We're hearing about food banks at airports for airport workers. We're hearing also about Hurricane Melissa down in the Caribbean and relief efforts down there. But here in Plymouth, you're talking about some services that are available right in the community for people in the community. So how would someone participate and get involved and benefit from some of the services? How does a senior arrange to come for a meal for the cacciatore?
Right. We advertise a lot on Facebook. I do put it on my sign out front, and word of mouth is probably one of the greatest things that happen. But when folks call the Corps, they meet my administrative assistant and volunteer coordinator, Jennifer Schaller, and she makes you feel right at home. And if
So they can just call.
they can call.
What's the phone number?
Oh, that I know. 508-746-1559.
Okay.
Yep, they can call anytime and ask.
And they don't have to be a member of...
Oh, heavens no.
Okay.
Heavens no. Nope, they can come down. And also, if there's a need, there is great food insecurity, as we know. I think yesterday we saw 35 to 40 families come through. We have a food pantry, as many of our other brother and sister churches and organizations do. But ours is a shopping pantry. And I've worked very hard for folks to be able to come in be able to go down and pick the food that they want and need. They don't need me to make a bag up of garbanzo beans that they're never going to eat. But if they come down and have that dignity and saying, well, here's a roasted chicken, have a chicken, put that in, because they feel good after coming through that, because it's choice and it's being welcoming. So our seniors do that. We have the regulars that come down, and we have those that do walk-in.
Do people, when they call, do they have to fill out an application or prove that they should be receiving these things? Is there a financial requirement?
No, there isn't a financial requirement. What we do ask is we do like to do an intake form so that we know how many people are in the family, what are the needs that are, but that stays right within our building. That doesn't get sent anywhere to anybody. It's all about this. It helps me to be able to say, I pulled up a couple of statistics here. Around 18 million in U.S. households live with food insecurity. The Salvation Army served over 183 million meals to people facing hunger in 24. And we continue to do that. So they can come in and they can either walk in and we will get some basic information, and then we'll make an appointment for them to come back once a month to be able to get that food that they need. And right now, our pantry is getting cleaned out. So we're looking to be able to find more ways to get food in. And that's what we're actively seeking now, because the need is great and we want to be able to help each person that comes in.
And the need could be greater. We're hearing that even at the federal level, SNAP benefits may no longer be available.
Yes.
Which again, is a source of food to some people.
Yes. Yes. I was talking with somebody yesterday, one of our businesses in town. And let me say first that I love our businesses. It doesn't matter who it is, Hearth Artisan Bread, Wood Seafood, any of the businesses in town. And if you drive by our building during Christmas time, you'll see a big metal Christmas tree that's up there. And the slogan goes, light the tree that lights the community. Out in front of there, you'll find business names that look like presents that go in the ground. This is a way we thought of trying to raise that. This year, I have $90,000 I have to raise. Okay. When you see those businesses, they've donated a certain amount of money to the Salvation Army because they know it's going to go where it needs to go to help people. And those businesses make a difference. So to get back to what I was sharing with you, this business owner in town called me and he said, I'm going to speak to my workers because I know the struggle that people are having. And I want to know, should I go shopping for you? What do you need for the pantry? Should I provide finances for you? How can we help you? And that's a business that I love because they're willing to be boots on the ground, which is what the Army is active and making a difference. And then I honor them by saying, look, you need to get something. You need to go to this store because they help our community. It's people helping people. Even Christchurch Thrift Shop has given monetarily so that we can buy toys for kids for Christmas time. Nice. We send out our angel tree tags. We do that. Folks shop and those toys come back and we help families that have a need. We're a supplement. We're not their full Christmas, but we make sure that those who have needs, those needs are met. And if one little kid wants a blow-up glowworm and that's the only thing that child wants, I'll be darned if I'm not going to go find that blow-up glowworm for that child because that's what Christmas is. And that's what love does, unconditionally.
So I've been a member of the Plymouth Rotary Club since the late 70s, and one of the things that our Noon Club has done is ring the bell.
Yes.
The Salvation Army. So tell us a little bit about that. What is that all about?
Well, I know people see the red kettles out at Christmas time for sure, and some. I've been known to do it in the past myself before I came heavily involved, go through the other door, whether it's the one selling cutting boards or something going over here. But those red kettles is how we raise our budget. It doesn't come from on high. It doesn't come from, magically appearing. And we, every dime, every nickel, every dollar, we don't have tap to pay like some organizations do. We're still coming up into that. We do have QR codes where people can use their phone to scan. And in an era where people aren't carrying dollars in their pocket, it makes a difference to us. But thank the good Lord for the Noon Club and for the Sunrise Rotary, because they do stand for us. You'll see the Sunrise Rotary at Walmart this year at a kettle, manning a kettle for us. And the Noon Club stands at Target. So if you're in the mall, you'll see our angel tree. Mary Lou Folsom has done this for 50 years, has an angel tree out there with a tag that you can grab and buy something for a child. And our wonderful Noon Club is out there ringing the bell, and every dollar that comes in goes right back into the community, whether it's for our after-school program, keeps the lights on in the building, keeps the heat on, it supplements food that we have, it runs our programs. Everything that comes in, we're the largest organization that only 10% goes back to serving at headquarters. And that's what funded I'll tell you, that's what funded my job in the music department for 23 years, was that little bit of money that from all the corps. The rest goes back out to the community, to Plymouth, Kingston, and Carver, to meals, to the pantry, to whatever we have. And it's a big nut to crack. When I look at that amount, I say, okay, last year it was 75, and we made a little more than that, and I was very grateful. And this year is 90, and I say, okay, God, you're going to have to do what you do and send good people like my board to say, this is where you need to focus. So if it's knocking on doors, I'm willing to do it. If it's helping a child, I'm willing to do it. And my son is a byproduct of that. He's the Barnstable Performing Arts Director in Barnstable, and he graduated from Plymouth North and went to Gordon College for his degree and graduated from BU with his master's. And now he has the Tootie Orchestra in Boston with a lot of conducting the folks up there from the BSO, and also does the South Shore Conservatory. So the apple doesn't fall far from the tree. He doesn't have to wear a uniform to make a change in a life. So most folks don't know. They just see the kettle or they think thrift shop. And if I had pants, I will give you pants. That's for sure.
So the Rotary Club is an international organization, and we talked earlier about the history of the Salvation Army starting in London. So it's currently an international organization?
It is. It is. As a matter of fact, in Plymouth, we've been in Plymouth for 145 years. Wow. Yes, up at Coles Hill.
Coles Hill?
Yep, that location for a great long time, and now over at 52 Long Pond. There's a big history. And as a matter of fact, on November 4th, we will be doing our first kettle kickoff. It's a symbolic thing. It says the Christmas season has started. And we have Representative Gatsky, who will be out and dropping the ceremonial coin in the bucket. The North River Brass Quintet, along with Major Judd Laidlaw, will be playing all the holiday favorites out there in the gazebo. And then we'll be in Plymouth on the Town Hall lawn on November 5th. And we have former Senator Teresa Murray. Chief Dana Flynn will be down speaking. And it's just a time with more music and singing and dropping that coin in to say, it has begun, maybe our 146th year now, doing that to help people. It's all about helping people and bringing love unconditionally with businessmen and lawyers like yourself, sir, to Alan, to former chief of police, to the everyday child that wouldn't have a chance to sit on a piano bench or take a lesson because they couldn't afford it. I'll put that child on a piano bench. I'll get them as far as they need to go, and then I'll make sure they're at a qualified music teacher to go beyond. That's where my son started. And I know it makes a difference.
So, Pastor Ridge, you are one of Plymouth's spiritual leaders, and recently at the October town meeting in Plymouth, you gave the invocation. It was a poem. It was lovely. And we talked about the brass musicians and participating in the spring, but tell us a little bit about that, about the music that you offer from the Salvation Army.
Yes, on Sundays we have a full worship band that plays. It's not a brass band, but it is guitar and bass and drums and vocalists that love to sing. But the Salvation Army was founded on brass music. And a matter of fact, I believe it was last week, we were up in Norwood at Waters Church, and the New York staff band, an international staff band, if you Google them, you'll find some tremendous music, came and did a wonderful performance up there. I was able to participate as I'm a percussionist in the Massachusetts brass band, so Boom Chi and Chi Boom, she was up there playing the timpani, to a standing room only crowd, and it was wonderful. So brass music is at the heart, the English version of brass music. And those musicians play and they give back, 1,000-fold for what they do. And that's where we're one of the largest organizations teaching young people in music and the arts in the country. And most folks don't know it. They know us from the thrift shops. And those thrift shops help our alcohol and drug rehabilitation families to get on their feet. When you give to the boxes or you go to shop at the thrift store, those funds fund those places. That's what happens with the thrift shops.
And we've talked a little bit about how people could avail themselves of some of the services and benefits. But if people want to help out, I mean, can they give to the thrift shop? Are there other ways in which people can help the Salvation Army?
Absolutely. I love my volunteers, and I can never have enough of them, whether it's being a concierge, that's my new word in 2025 here, to escort someone through the pantry, or it's helping with the signups for Christmas, or it's getting our grab-and-go meals ready. We always need sous chefs and people to chop a bunch of onions for Sarge. Or it's helping with the breakfast. There's needs no season. So volunteers can call and talk to Jennifer, and we will get you in and assigned to something to do. And probably the biggest need right now for us is at our kettle sites. Now, we can pay kettlers to ring. Last year I had 2 paid, and the rest were all volunteer. And what that allows me to do is to take that money and use it where it's needed most. So if I can have volunteers and you have a sports organization and Plymouth North wants to go against Plymouth South and take each end of Walmart and see who raises the most funds for bragging rights, I'm all for it. The Noon Club and the Sunrise Rotary, Kiwanis, I'm all for it. That's what helps keep the money locally in Plymouth and allows me to do good with the funds that we have. And our books are open to anyone to see. We're written up with Forbes, and transparency is what we're all about. You talk to Alan, he'll tell you. He has the 411 on all that we're doing.
And we talked about Thanksgiving, and it's a month away. Mm-hmm. Is it timely now to begin planning if somebody wanted to get some food for Thanksgiving or help out?
Absolutely. Absolutely. Our Sunrise Rotary actually packs our bags for us. We fill the whole hallway of the building with food, and they pack those bags, and then we get the turkeys. And right now, that's what we're shy on the most. I was able to get 60 from the food bank, and the way the food bank works, it's poundage. So that weight comes off of the total order that we would normally get for dry goods. So right now I'm shy about 50, 60 turkeys, and I'm just praying and seeking how I will be able to get more of those to be able to give it out to the families that are currently signing up. But anyone can come down, give a call, talk to Jennifer. We'll get you signed up. We'll get your name out there, and we'll do the best we possibly can for you. And the same thing with Christmas. You know, if you have young children and you can't afford to be able to help augment those things, their only requirements is that you have a record for your child, a school record or a birth certificate, so we know that those are your children, to be good stewards of what the generous community does for getting toys for us.
And we talked earlier about the phone number people can call, but can they also just stop in?
Please. I love it when folks stop in. I'm always glad to see folks. Yes, they can. Just come into the parking lot across from Friendly Ice Cream, 52 Long Pond Road, and park your car, come in the door. You'll see the office is right there. You'll be welcomed. We can give you information on the food pantry, information on anything that you need, and how we work with our partners like United Way and those in the community. And if we can help direct you, then we want to do that. I always say, our bathrooms are clean, and it's good to know where to go. So come on in if you need to stop. You know, I love to see people come through the building, love to show off. I've invited you, attorney, to come down anytime and kick the tires, see our half-court gym. We have Plymouth Hoop Academy that teaches down there, and it's just a wonderful place to see and to come, and everyone is welcome.
And what hours are you open?
We are open at 9 a.m. to about 2 p.m. for the food pantry, Monday through Thursday. Friday, we're closed. There's generally somebody in the building catching up on all the paperwork and restocking, but we're closed then. We're open on Sundays, of course, for church service, and we welcome anyone who wants to come. Pardon?
When's the church service?
Sunday morning at 11 o'clock is the service time, and we have adult Bible study at 10.
Good.
Yep, and the children are well taken care of, and we have a Sunday school superintendent that looks out after them, and it's good. Everybody's welcome.
So when you're not doing work with the Salvation Army, what do you like to do in your free time?
Oh, my word. I love music. I've been writing music since I was 12 years old, and now I have to use my horse foot to count how many years. It's been a long time. I've written music for music symposiums and for record labels and different things for years. So that's what I love to do. I love to write, spend time in music. I love to garden. I love being out with feeding the birds, and I love helping people. So anytime I can do that, that gives me a lot of joy.
Now, one more time, the phone number where people can call.
Absolutely. I should sound like WATD because I love Rob Hackler and all the folks down there. They've been very good to us. And Rob always ends with his tag on the phone number, but it's 508-746-1559, or as Rob says, 508-746-1559. Yep. And they've been really good to us at WATD, and I'm grateful because it's community people. Our back-to-school effort, if it wasn't for WATD helping out and coming down and doing a live broadcast at Walmart, we were able to get over 10,000 items that we were able to give out to kids for backpacks, for schools, for teachers, for supplies, because they're our unsung heroes. They're on the front lines of making the next generation be the greatest generation. So if we can help doing that, then that's what it's about.
Good. Pastor Ann Rich, the Salvation Army, thank you so much for joining us.
Thank you so much for caring. Yes. I really do appreciate it, and the local scene.
We love hearing about this. And yes, thank you to the local scene, to Melissa Mattinzi, and her staff that are here.
Amazing.
They've done a great job.
Absolutely.
Both in the studio. And this completes this presentation of Plymouth Profiles. Please join us in the future. We hope you enjoyed today's guests. We're thrilled that they were here with us, and we look forward to bringing more in the future. I'm Steve Triffletti. Good day.